All right, so if you could introduce yourself and tell us the position that you have at the University of Rochester.
My name is Bryan Yates. I'm a senior research coordinator at the university. I've been here since 2015.
So what projects have you been working on since 2015?
I've worked with Peter Wingman and other faculty here at the university on specifically suicide prevention within the Department of Defense. So DoD funded studies for the United States Air Force to look at the changes in trends for suicide, but also to develop a program for them that is more modern and fits with their needs.
What's your background?
I studied psychology and a little bit of epidemiology here at the university. And prior to completing my education, I was a combat medic in the United States Army. So that was kind of where I got my exposure. I'm also from a military family. My father was a pilot in the Air Force, but always been around the military community in my life.
I'm trying to think, 2014, 2015 we met for the first time? Someplace in there? No,
yeah.
You're already working for the university, so it had to be 2015, right? I think you just
Yeah,
started.
I think it was summer of 2015. We met in Denver, right?
Right.
For
yeah.
at the Sources of Strength,
Right.
Train the Trainer.
So what are protective factors?
Stability, whether that's geographical, financial stability, is very protective. Overall connections and relationships and depth of connections of relationships. Proximity within a social network, all directly related to relative levels of protection. In particular populations, you may see additional elements such as, in the military, your rank is protective. Your time in service is protective. The longer you are part of that institution, that has its own protective factors.
We use prevention for every term in the whole wide world, but we know that we've talked about this, is that many programs are interventions. So how would you describe the difference between prevention and interventions?
So thinking of intervention, we see that the problem is not only present and identified, but we're targeting the parts of the population or the individuals who are experiencing that. Like prevention is much bigger. Particularly the upstream prevention that we do is meant to put people on a different path so they do not arrive at this negative outcome.
You really did the heavy lifting for developing the Wingman Connect, right? And so, again, as an approach of what we did, how was that different than other programs being implemented that you saw?
For Wingman Connect, I think the development differed substantially in that it was developed in-house. It was developed with input and feedback from our partnership with personnel at Shepherd Air Force Base. So continuously bringing our findings to them, and asking their assistance and interpreting what we were seeing. And also, aside from the partnerships that we had, it was a very rigorous, data-driven approach where we would make developments on the program, tailor the content as well as the delivery, and collect data on that, review the data, use the data to make the next round of revisions, and just continuing that cycle until we would reach some kind of critical thresholds for memory recall of the content, really getting engagement and reception from the participants. Aside from just the training content, that's really important for the implementation strategy, so that we can work with other personnel of the base to find when does this training need to be delivered, how much impact does that have on participation and engagement, and what are the additional requirements of the environment that we really need to work around and accommodate so that it can have maximum impact in the training sessions themselves.
Let's go back to timing. When did you find out that was the best timing? Early in your career, middle career, late career? When was critical to get prevention into the lives of people?
Regarding the development of Wingman Connect, we saw pretty quickly the importance of delivering the prevention training to first-term airmen early on in their tenure at technical school. Getting that prevention training early when some of the group norms are still kind of forming. It's kind of important to, if possible, to really address that state of plasticity, in their social dynamics, before things become too well defined.
Talk about the quality of research.
We use kind of a gold standard randomized control trial design to evaluate Wingman Connect with these first-term airmen. There was an active control condition that really compensated and tried to address time spent with us, as well as missing some of their training time to attend the training. So having that active control condition is a stronger way of evaluating the impact of a program compared to simply presence or absence. It's not something that's typically done. It does take a great deal of intentionality and a tremendous amount of time to do that type of research in the field, in particular, in operational air bases. It took a lot of support and coordination from the bases themselves, like a lot of willingness on their part to allow us to match and pair classes and randomize selection to intervention condition so that we would be able to make that strong comparison.
How long did it take you to develop this program?
Wingman Connect was developed over about 17 months on location at Shepherd Air Force Base. It really went through a couple large phases. The first being addressing how do we take these concepts and how do we tailor that to first-term airmen, to have a program that's relevant, it's meaningful to them, it's something that's useful in their current environment. And then the second phase was really refinement, where we went back really focusing on engagement and participation. How do we make the training meaningful to all the participants, not just the select few that are most active or engaged?
So what did you see that led you to developing a new approach versus relabeling, rebranding an old program, or just using old programs that are out there? Why the new direction? What did you see that led you to that?
Prior to really getting boots on ground with the development, we had a tremendous amount of support from the Surgeon General's office in the Air Force, who kind of identified this career stage of technical training school. It's after basic training.
Why social network health versus risk factors, warning signs?
Well, I think there's a couple of things that are relevant with that. One is existing programming was focused on more late stage prevention, almost intervention, which really addresses those risk factors. It's about identifying and assisting or treating individuals in a state of crisis. But alone, that level of prevention is not going to be as effective as opposed to being combined with some truly universal prevention, something that is upstream, that allows the whole body, the whole population to be trained together in a setting. So decreasing the stigma of the intervention itself by making it applicable to all service members. It also leverages the inherent strengths and benefits of members of that population or members of that technical class who are thriving. By training the group together, you can leverage those really thriving members of the population as an instrument to teach others about what has worked for them, what is working right now, something that we can't bring in as outside instructors or facilitators in a way that's relevant, meaningful, useful to people right in the room who may be struggling, but not at a point where it's noticed to everyone. I think the other aspect of why we really had to build something new was something that has gained a lot of focus in our programming, things that we work on, and it's the idea of addressing ecological validity. Given the nature of the military and what life is like in the military, the hierarchical system that it is, and how the organization is structured, this idea of a universal training where everyone is trained really is the most valid to fit into their system. Aside from providing that decrease in stigma of providing help with soft skills, help training, I think it's also important that you have that opportunity to focus on natural organizational elements and the dynamics in there is to really build those connections that ultimately can be better protective factors for struggling airmen than simply a bunch of new information or some contact information for a crisis hotline or things like that. They're naturally reinforced by the group dynamics.
How would you define or explain upstream prevention?
I think of upstream prevention as addressing the protective factors of a potential problem. So really building strengths and building a foundation that gets people over a hurdle that maybe they haven't gotten to yet. Getting farther upstream or to the left of the problem really gives you the opportunity to kind of put those individuals kind of on a different trajectory, so that hopefully they don't even end up in the situation where an intervention is necessary to prevent an outcome.
What is our ability to predict mental health issues?
Particularly for suicide risk, these are very rare outcomes. It's very difficult. It's not finding a needle in a haystack, it's finding a needle in a stack of needles. Even the strongest predictors of death by suicide, are 99% invalid. Major depressive disorder has one of the highest associations with a suicide attempt, but more than 99% of people who have a major depressive episode don't go on to attempt suicide. So it's very difficult when you look at this through the lens of solely individual risk factors to develop a true predictor, something that is really actionable. We're not looking for a retrospective statistical indication. Like, we're looking for something that we can use as a proxy to guide and inform our prevention efforts. And I think that also comes back to, the idea of the upstream prevention, and the necessity of it, because in the absence of a very strong ability to predict suicide attempt, the only way to ensure that you are reaching the parts of the population that either now or someday may become at risk is to have that universal prevention where everyone receives it. They receive it with their peers, in the context of their own environment, in a way that doesn't make them feel targeted or in some way selected over others as needing treatment or intervention. There have been programs that failed to produce any evidence of increased protection or increased connectivity. We used a very rigorous design to evaluate the Wingman Connect study, and others don't have the ability, they don't have the time or the space or the resources to necessarily set up an elaborate design like that. There are others that have been rigorously evaluated, in which the outcome is no different versus treatment versus no training.
If you can remember our conversation about the one-time delivery, if you can sum that up, I thought that was really powerful what you said.
The issue or the challenge with a single dose or one-time delivery training is that it doesn't really address that ecological validity, which is a combination of the norms, but also the culture and the motivators within a population. When we think about other things that we deem very important socially, we don't address them in a one-time fashion. We don't teach reading, writing, and arithmetic that way. It's repeated, it's addressed, it's maintained and monitored. These are things that we keep our thumb on the pulse of these things. So, considering a prevention effort, there are certainly a lot of advantages, feasibility-wise, utility-wise, economics, like to do a single session training. But I don't think that we can really anticipate or believe that that's going to be the best way. As social beings, like, we don't really address problems in that fashion. The desire, of a community or a school to address something that they are seeing as a problem also provides them that opportunity to do so as a team. Like, teams don't get together once and then consider themselves to be on a team after that. In order to have that kind of continued persistence and motivation to engage a problem and have an impact, a longer term shared purpose and direction has to be applied to kind of maintain traction and keep things moving forward. The other thing we've seen is that a one-time training may have some impact, but if it's not monitored and cultivated, it may slide back farther in the opposite direction. Having that continued presence, having really relationships built around working together to address these issues, it is just as much part of the solution as the content.
What's the benefit of multiple exposures, and how does that increase norm setting?
I think in order to achieve the most impact over the longest period of time and have that program be sustainable, it's really necessary to kind of bake it into the culture of the population that's receiving. As a facilitator, to understand that environment, and really making that part of the training as well, which is like to bring out the experiences, the motivators, the goals of the participants, and getting those front and center in the training is really necessary so that you can know the environment well enough to really fit the concepts of the model to that training environment. And that needs to be done over multiple passes. Like when working with the military, we're at a specific career stage working with those airmen. When they're in technical training, they're learning their core job proficiency skills. A few months later, they're going to be at their first operational base with maybe one or two people that they came from training with. But other than that, they're in a completely new environment with a completely new social network. With the network focus of the training, really building those connections. By doing it multiple times, they can continue to bring that to their work groups or like their new settings. The ability to have that delivery at different career stages and different time points is really important for the longevity of the impact.
What are the benefits of active learning? As
an outsider or as someone from not within a social network, we're never going to be able to have the best example that is going to be the most meaningful or the most understood to the participants. So by having those activities and exercises that really kind of draw out their perceptions, and then allow us to work within our conceptual model, but really to kind of map onto what we're already hearing from participants, and getting them active in defining what we're talking about makes it a lot more meaningful, makes it more relevant to the participants in the moment that one of their peers is really providing the definition to a concept. It's not us. It's not external, trainers from afar that are telling them what something is, what it means to them, and why it's important. We can hear from the participants in the room, and having their input, kind of working together with a model, begins to put together something that's really usable to the people in the room. It goes without saying, like, people don't want to be talked at. They don't want to sit and receive a training. And by having that active participation, you really allow the whole group to, kind of have that self-efficacy to, like, they're gonna shape how things go. They're gonna work on this together. And it provides some autonomy to the training experience. The group itself can dictate how much or how little they want to participate, but it begins to develop that kind of group identity for each individual training. I also think that active participation is really a necessity. If you want something to extend beyond the training, well, you have to have an opportunity to do some of it in the training, where the group can work together within the training, to start to experience some competency in those skills, but in their own frame of reference, and then building throughout the training to activities outside of the training space. In summary, I would kind of state it all kind of works backwards. If we really want people to behave differently out in the real world, then we want them to actually use the skills, take the skills outside of the classroom, outside of the training, and put them to use intentionally, and work on these things either together or as individuals. But in order for them to be confident, in doing so, we have to create space within the training, for participants to develop those skills together, where they can get valid feedback from their peers, and then that all comes back to they have to be active participants in the training, in order to make those connections.
Participant sharing is really the teaching tool, right? It's a teaching instrument.
Participant sharing is essential, to this style of a training, this active learning, this experiential learning, having the participants share. And as a facilitator, it's important that we have to kind of extend that leap of faith first. We have to model those behaviors in order to redefine the training space. There's a sequence of things that we found need to happen. First and foremost, we have to engage the participants to the content, but we can't do that without engaging them ourselves. So we have to kind of set the norm, and model behavior that we say, like, hey, this is going to be an open training. This is going to be about what's important to you. And start with those questions, because from group to group it's going to vary, from population to population it's going to vary. But if that is part of, that's step one of your core content, which is to draw out those experiences, those perceptions, those beliefs and values, those motivators from your population. Now you can put that to use throughout the entire training to start to work on the rest of the list of things to do and break down the barriers, break down the social stigma of talking about some of these more sensitive topics, starting to get people to understand each other on a more personal level, a deeper level, by sharing what gives them purpose, what drives them to do the things that they do, where do they see themselves in a few years. Those are important topics, not for us to hear as facilitators. It's important for the other participants to hear those perspectives from their peers. We only have a certain amount of time with each training group, making sure that we're leveraging the powerful statements that some of the people in the room are going to have. They're far more powerful than anything that we can show up and tell them. Beginning to create the training space and the willingness of the participants to share those things in the room is the foundation for all of it.
So let's talk about sequencing. Do we just do any activity, or the activities and conversations sequence?
I'm sure there is a way to not use sequencing. I just don't see it as being economically functional because of limited time. We can't block people off for a week. To really make a training efficient, sequencing is really essential. So being very meticulous in how we do that, really starting off by defining the training space, and thinking of the entire training as having different focal points in a particular sequence, starting with defining the training environment and our facilitators modeling the behavior that we expect of the participants, delivery of kind of the foundational concepts so that are the core of the training through the words of the participants, asking for their input. What does this mean to you? Then that's our conceptual delivery, and then moving on from there, really addressing individual level skills, and then moving from that to identifying kind of the commonality between the participants and like how they view these concepts, and starting to address the relationships that they have that are centered around those ideas in their personal lives, in their schools, in their academic lives, in their professional work environments. So we bridge from individual skills really to individual relationships, the connection, the other half of that relationship, and that's a big bridging step in order to be able to move to the last section, which is going to be addressing the connections and the relationships within the group right there and present. So really intentionally building up to that point by starting with low sensitivity, lower risk questions, getting people talking about things that are easy to talk about. You can't have the hard conversations if you're not even comfortable in the easy ones. So really providing that opportunity within the space, for people to really self-determine their level of sharing. How detailed, how precise do they want to be? How much do they want to, show their hand? And accepting that, validating their level of participation as, that's what we want, and letting them kind of grow and develop that and deepen at the rate that they're willing, and not kind of throwing people out there into a place where they're going to push back, or they're going to close off, or they're going to address the concept but not through their own lens. If we're limited in time and resources, like you have to understand and utilize sequencing or layered delivery if you want to be really economical in your time.
Is there a correlation between a facilitator talking less and growth of participants versus facilitator dominating the whole time and growth of participants?
From my experiences doing these types of trainings, like there's kind of a critical threshold that you have to stay below so that the training is not about me and what I'm saying, and it's really about what I'm hearing and what's really important to the people in the room, and it's somewhere around 50%. It's always a goal of ours whenever we attend a training to make sure that that I'm doing less than half of the talking, because if I'm taking up more than that, I'm taking away space and opportunity for the participants to share. And what they have to say is naturally, logically more important to the other people in the room than anything I have to say. I think it is really important for the experience of participating in a training, as well as the impact that having been trained has on the participants to stay below that 50% threshold and allow maximum time for individuals to hear from each other and really learn from each other.
There's some evidence showing that when participants speak for 100 seconds in a training, that some positive things happen. Yeah, so can you tell us about the 100 seconds and what you're kind of seeing with the participation's growth?
We've been doing some new things in terms of measuring engagement, particularly since we started doing it online. A lot more media was being generated to give us an opportunity to look at things in a bit more detail, and we found some really interesting things. One of which was a higher degree of participation verbally. We knew all the participants were there the entire time, but whether or not an individual shared at least 100 seconds worth of personal sharing during a training had an impact not only on their reports of accessibility and usefulness of the training, but also their self-report follow-ups of did they actually go out and try and utilize these things outside of the training. So there's definitely a connection between engagement and participation and motivation or likelihood to actually try these things out once they leave. This is a group of individuals who know each other and spend time together as it is. So for them to verbally state something in a training naturally carries some weight with them. They are more likely to action on their own words if they share it with their peers. We kind of stumbled upon this association where it was around 100 seconds, and if those participants who shared their own personal viewpoints, stories of their past or about their values and beliefs for 100 seconds, we saw an increased output from that, an increased willingness to take the content from the training and transfer it into their life.
Yeah, it really goes back to just being an observer at a training versus being a participant in a training.
I still think one of the most interesting things that we saw in analysis of voice recordings from the online Wingman Connect training was specific mention of an individual's purpose, and individuals who did shared a personal story about what is their purpose, what motivates them, or what goals they have, what values and beliefs really shape their goals. Had a huge correlation to, like I said again at follow-up, saying like, yeah, I made it a priority. I did this intentionally, since I attended the training. I've tried to make this part of my activities of daily life is to be stronger, in these 4 areas. And I think that it kind of reinforces that same concept, which is words are powerful. Their words are more powerful than my words, not only to the people around them, but also to themselves. If they have kind of aired out or declared, their sense of purpose in a training, like it stays with them. It becomes an action item for them. We've seen a significant increase in suicide completions in the U.S. Air Force. The rates in prior to 2008 were significantly lower than the general population of the U.S. And after 2008 they kind of began to really correspond to the general population rates. This wasn't interpreted as some introduction of some risk to the Air Force or to the military in general. This was indicative of some loss of protection. Young service members were not immediately protected by their service, which had been observed for so long.
Yeah, I'm going to run with that.
Mm-hmm.
March 13, 2020, we're sitting in Shepherd Air Force Base and we're at a general's briefing. So we're sitting with General Bell. Toward the end of this training, we know that the suicide rates for airmen are significantly higher, right? Mm-hmm. And I remember General Bell, after your presentation, looked at you and said, So what is the number of suicides within our cohorts? Remember your answer?
0.
0. Yeah, that's pretty impressive. I mean, when everybody else is, take pride in that right now, right? So, because I'll be honest with you, I didn't know that number. So I was prepared to hear 20, 30, 40, 50, because that would have been lower than the range of what was expected, right? But I still thought, oh man, if we had reduced it by half, it would have been phenomenal, right? And we went through this thing and 0.
I mean, full disclosure on that, the study was not designed to inboard medical data. We were only working with self-report and, from, our close partners, in the Air Force. So I would be reserved to say that it's 100% conclusive that, like, in neither condition, an airman was lost. But when you think of the rate increasing, above 26 per 100,000, that's a standard way of calibrating and quantifying, people we lose to suicide, 26 per 100,000. Well, then, in an Air Force of 330,000 people, that starts to be a real number, attributed, to real lives, pretty quickly. And, thinking about those numbers, going up a tenth, it's hard when you think about it, about what those numbers really mean. As a former service member myself, like there's some unique aspects of a military population. One of them is mental health, help seeking, has been very stigmatized for the longest time, and they are beginning to right that ship. That's a reality of the environment that we are delivering in, that we're conducting research. That's the reality of the population that receives this training.
We create space to let people practice. They really test drive all of this, right?
The person sitting next to them shares something meaningful and powerful, is just going to continue to raise the bar in terms of how deep and meaningful each of those personal sharings are. That's really what allows people to take something away from this is like, it's already translated to their language. It's already put into the context of their life.
Let's talk about the concept of drift that was written about in 2022, or as we called it early on, pruning. Do you have a way to describe it? What is pruning? What is drift?
Pruning or drift, as we see it, it's fairly common. There are multiple reasons for it. In the military, where it's a competitive environment, it's a professional work environment where identification of risk factors may warrant decreases in social connections because people are ambitious, they want to succeed. So separating themselves from people who are struggling or who have had setbacks, is maybe not the most compassionate method, but it's what people do. People do it in professional environments. People do it, on basketball teams. It's a natural act of self-preservation. If certain individuals stand to benefit, that creates the competition. And once that competition is solidified as a norm within that community or that population, then pruning exists, because there are individuals who are motivated to a particular outcome, where it's non-beneficial for them to maintain connections with their entire network. It's not typical for those discussions to take place, within those natural working units. It's not intentionally factored into their workday to discuss their values and beliefs in the context of what drives them, what motivates them, and that space has to be created. And in a very busy work environment, unless you're dead set on creating it, it's not going to be created on its own. Having that space for people to have those discussions starts to really look at it, and instead of having people focus on that one single outcome, that one measurement of success that is filtered through the competition, it allows people to start to see broader values in the people right around them, greater strengths. Maybe they aren't, succeeding in this one area, but they have tremendous experience and knowledge, and strength in another. And really bringing the participants to a point where they see everyone else in the training like as a person and not just as a metric of some grading or some evaluation on the competitive scale. They are not a winner or a loser in a single dimension. Like they're a person, just like everyone else. We have strengths and weaknesses. So to see everyone else in their network, in a broader sense like that, has been shown to prevent pruning. We see technical training classes that didn't receive Wingman Connect training. They received an active PowerPoint driven, very traditional military type of informational training, didactics. And airmen who were elevated risk, for suicide at baseline were much more likely, to be kind of socially pruned, to lose network connections within their own training class over the course of the next 30 days. And we didn't observe that. In classes that were trained in Wingman Connect, we saw that airmen who were elevated risk for suicide at baseline prior to the training actually increased. They had more connections after the training. So offsetting that pruning is really important because they're still members of the same social network. So thinking of the entire network or the entire group really as the recipient of the training, it's important to have like those redundant connections within that network. So to have any member of a group become isolated and lose connections, that's overall a negative impact for the entire group.
So it looks like groups that have been trained on social network health increase the number of social connections for those people that have the highest suicide risk, whatever. And groups that haven't been trained around social network health, they were pruned out. Am I in the ballpark with saying it like that?
Yeah, absolutely. I mean, I think there's one preface, and that's Wingman Connect, just like the school prevention programs, like focuses on the social network, and having that as part of it. It's not just an individual skills training, but having that network focus. So those classes that received the training, maintained connections across their entire network, regardless of risk factors, which is in stark contrast to other classes that didn't receive the training, where we saw pruning of those members. Maybe they had a setback.
What makes for a strong program? Give me the aspects of a strong program. If you're going to start from scratch, grassroots, what are critical factors that need to be there?
I think a strong program really has to address two fronts. One being, what is taking place like in the trainings? Is that content accessible? Are the skills being delivered? Are the activities engaging and really bringing that personal sharing in? And I think the second front is, what are the services and supports? Like, what are the accommodations made for that program's long-term implementation? Does it have local champions? Does it have instructors or trusted adults who are invested and are participating, so that it doesn't drift and change and morph over time, so that it remains adaptive and aware to the changing environment? So having that background and that support is essential to sustaining any program. It can be delivered initially, but without that aspect of it, the content isn't going to move with the population. It's not going to continue to evolve. It's kind of a combination of those two things. It's what is in the training, making sure that it can and does make a difference for the participants, and also making sure that there's kind of a feedback loop. Who's making sure that it's taking place, making sure that it's happening. I think we struggle a lot really trying to define what it is that we do. Are we a trainer? Are we an instructor? I think we finally settled on facilitation because what the participants are bringing, that's the content that we're teaching. It requires a different skill set, to facilitate. We're not projecting a black and white image of what is correct and then trying to get people to accept and adopt. We're creating a space for people to engage with material so that they can kind of build it up into a skill set. We're not, projecting anything onto them. And I think that requires a lot, not turning everything into a teaching moment and letting the participant voices kind of rise to the top, never stepping over top of like what is being said by those participants in the room. And that takes a lot of humility to sit back and let a group define your concepts the way that they want. But that's necessary. When we're looking at, who could deliver this in the Air Force, we're always thinking about
we look for the intangibles, right?
Yeah.
Do they have that intangible piece versus, we can teach them skills, right? You can teach them content, but
Yeah.
do they have that ability to read
Well, I think
the
that's-
room, be present?
Yeah. It boils down to their abilities, not their experiences or their training. Can they sit in a space and be comfortable even though it's an uncomfortable space? You need to model that behavior. Can you accept and validate, responses that you get that are not what you're looking for? Can you kind of guide those initiatives? Can you understand when it's appropriate to ask somebody to share more about something versus, reading that situation and knowing they've reached their comfort limit? Like, we should find somebody else and not push this any further. Because it's just as much of an understanding of what not to do as it is a structured pathway of the things that you must do. What percentage of things that any of us know did we learn directly from a book, or a PowerPoint slide? We didn't. We learned most of the things that we put into use on a daily basis from someone else close to us, somebody that we spent time with. That's true with this too. We cannot come in as outsiders, as civilians in the military or New Yorkers to a school someplace far away, and we know what's happening here. It's social emotional learning at its core. We're gonna give people some ideas to work with. We're gonna make sure that they have a chance to share as much as they want to or as little as they want to. We're gonna get up and play some games because you just have to break up some training. You can't just all be dry talk. I'm not gonna talk at you. We're gonna talk together. It's natural. Not really surprising that this is the format that is well received, that makes a lasting impression, and that can be used to do the one thing that we know will protect people, which is to give them connections.
And I think you just hit something, right? We go into a workshop not looking as people as a problem to fix, but they have the greatness and they have the strengths and they have the expertise. We just need to facilitate that space so those strengths and expertise and knowledge comes through. Right?
It just reminded me of that, it was like second grade, made stone soup. Remember that story?
No.
A stranger comes to a town, with nothing, comes to the community and is hungry, doesn't have any food, doesn't have any money. So he convinces, he rather than, he asks a few people for food and they say, no, we don't have enough. We don't have enough to feed our own. So then they just go and get a giant cauldron. They start a fire in the square and, he just starts boiling water with rocks in it. And he's like, I'm making soup for everybody. We're making stone soup. And people start coming along and be like, you're crazy. What are you doing? And he's like, we had some carrots. This would be really, stone soup's a lot better with carrots. And I finally get somebody to just contribute, some carrots, and works his way through, and more people come, and then everybody chips in a little bit, and then they, this community that was pressed to the point where everybody felt that they were starving and hoarding food is now having, stone soup together. And every time he would add vegetables or add meat, he would take stones out, and at the end everybody was amazed that this stranger came and made stone soup and fed everyone, but really, it was all there to begin with. I think. But thinking about that, that is what we're not bringing the fix. We're coming to help people, help communities, help classes, bases, to utilize the tools that they have, and the tools that they have are the strength of the people that are already there.
New ideas are great from the outside, but sustainable change has to happen within the group.
Why do you think the Standing Rock, Pine Ridge communities have been so successful? And if you can elaborate on those elements that you think are key to that.
A big part of this impact is valuing the personal connections, not arriving to a trouble, with a solution, but really establishing partnerships, and addressing the problem with the community's input, with their guidance. That as a starting point allows for both of the two necessities of a successful program, which is having content that can be tailored specifically to the recipients. Obviously, having an expert facilitator helps, somebody who does read the room really well, who has done it in multiple different places to really see the similarities in how a program must be delivered. But starting with those partnerships, and those valued personal relationships to see a program stood up and come to life and implemented, with sustainability as a factor, that has to be one of the starting points. And I think I touched a little bit on like another reason is, Tim's just too good in the room. I've learned a tremendous amount, from working with him over the years. I do remember, the first time we met in 2015 at a Sources of Strength training. I wasn't even a Sources of Strength trainer, but it was one of the programs that we trained and worked with and do here in New York State. There's a different set of skills, for a facilitator. It's not what I was used to as being an instructor, and I learned a lot from him on that, particularly around some of the subtle nuances of, what is on that list of things that you can't do in a room, that you need to be aware of so that you don't do them. How do you determine what you're seeing and utilize that to make, subtle redirections in the training about how you frame something, how you describe something, how you reference something. That's a highly developed skill set that he has, and I think it's something that's brought to each new program.
So what is this flow of workflow in between Tim and Rochester?
Thinking of facilitation as this broader skill set, I see a lot of value in doing it in multiple places. We know that the core of each of these programs, of each of these trainings, whether it's for airmen or middle schoolers, high schoolers, and in different pockets of the country, there's these mechanisms that have to be achieved in the room, so that we can get to the point of impact for the participants. And I think, it's been really fortunate that, we've had Tim on our team so that, we get that outside perspective. We're doing rigorous research within a certain population, but like having Tim bringing in his experiences from running the same types of trainings and the same types of programs in different populations, we can begin to see and really hone in on, what are these mechanisms? How are we ensuring that they are, that these aspects are being leveraged in the training, so that the training can be the most successful on the first day, in the first 2 hours or on the first day, and how do we bring that along the whole way? So here at the university, we measure everything, so we can try and parse out things that we see are important or things that show up in the data as being important. How do we bring those back to like what's happening in the training space itself? And I think having Tim's wealth of experience working with multiple different populations really adds to our team.
Peter used the word synergy,
Mm-hmm.
and I think that's what we're constantly doing. Right? We're taking different settings, different populations, and really finding out the best practices based upon research. Like you said, it's understanding the power of the expertise within the community and particularly within that training. And those are all things that we've just dialogued back and forth. And so I think we're really taking foundational principles, and we have for a long time had these conversations, hundreds of times in the last 7 years, to like, okay, really, what is it, right? We're really trying to make it a finite point of like, what is it? And I think like 100 seconds is a great thing to them, right? It's like one of those pieces, talking less than 50%. Letting every participant speak at the very beginning of a training, and letting everybody know that if we believe that everyone has a voice and all voices are to be heard and voices to be respected, then we need to create a space in which all voices can speak immediately at the beginning of a training. And every population, I use a different question right than what we use. And if it's a student, if it's a high school group or a middle school group or a parent group, if it's whatever culture and race, and there's a different question, but the foundational piece is we have to have space to let every participant speak at the beginning of a training, so we hear from everybody and they feel comfortable doing it. And so I think there's been just a lot of that going back and forth of playing with it. I mean, but we're also really, really good at taking a concept and looking at the research and playing with it. And I think it should be said that every time that we did a training, we processed about that. Could we be more efficient? Could we change language? Can we change the order of how it goes? What is the nuance? Or, hey, we really have these strong leaders in this class on day 2. Let's really use them to talk about support for mental health and help seeking, when we know that we had somebody with juice in a room, right? Versus somebody that might be a little bit more shy, a little bit more bashful, maybe not willing to share, and hanging them out to dry. We're not going to do that to them, right? And so it's all these things of just constantly working it from that. And we've never settled on a spot that's like, this is perfect. We've had great trainings, right? But every training we sit back and say, oh yeah, we need to stay with this format, or we need to tweak. And I think, again, that comes from research and understanding the research to be able to come up with best practices, and then implementing that and being. But I think that, again, it's a team approach. I mean, you have amazing strengths that I watch you work with military personnel. That's like, man, I wish I had that part, because you bring you to the training, and I think I bring me to the training, and our yin and yang of this is part of it. Co-facilitation is a great model.
Yeah, I agree. I think first and foremost, like the vision of beyond just the singular community or population. We're never going to get to a point where, we stamp the script and say, this is it, this is done, this is what you're going to say to everyone. But it's that ability of seeing and really working to achieve the same targets, in different environments, with different populations. That's really what I think has helped us kind of refine what are those mechanisms that we need to leverage, like in that space, so that we can, go from module to module, build from day to day, and reach to that point of building connections, within the limited time that we have together. The co-facilitation model, going back to, thinking of this idea of layered delivery, really being very intentional and structured in how you progress through a training. It's the same concept with having multiple trainers. Like, it's how quickly can we get people engaged, and the more trainers you have, and the more diversity amongst your trainers, that's greater things for people to associate with. So having multiple trainers, basically as soon as Tim got involved, in our Air Force project, something that we immediately recognized, a value to, where more people were getting engaged and participating, with meaningful sharing faster when we had more activity from multiple trainers.
And I think, it's also been really reinforced since we started this project of, don't dismiss the expertise in the room. And it's really condescending, and I believe it's damaging to building group cohesion when somebody walks in and says, I'm the expert, this is what you need to do, this is what you should do, this is what it should look like. And that's been another big piece that I think we've really focused on, is let's get the expertise of the group going right away. And then we introduce concepts and use their expertise to solidify those concepts into their lives moving forward.
We have a lot of mentions of our own research and other research, like in our trainings, but it's okay for us to be the subject matter experts of a research study, or in impact finding from somewhere else and from with different people. But the line is drawn very clearly. We can't show up with that and then dictate to the people sitting with us that this is what's important here, and this is what will make a difference here. We are researchers, and this is what we do, and this is what we have found. We're here to find out how to do the same thing here, not just replicate what was done somewhere else.
I have this thought experiment that I've been trying to get people to do. Most people don't bite. So imagine all the resources that you want are available to you, all the constraints that have been frustrating you in scaling on this kind of program, those are all gone. And they disappeared, and all the resources are available to you now to do whatever you want. What do you do on day one to get this type of programming out to a wider audience? Would you train trainers? How would you go about spreading this to a vastly wider group?
Yeah, so that's the $1 million question, is how do you upscale?
It's a little unrealistic, because I think the answer is somewhat dictated by the voids that have been created by unlimited resources and complete destruction of barriers and challenges. Any sustainable scaling has to have those things addressed. I think it does start with, for leadership, organizational leadership, to not just be given data about a study, or see research evidence, but to experience it, to experience the program. Something that we've invested effort in and continue to explore and constantly monitor is the ability and best practices for building a cadre of facilitators. We can't grow without having more people able to deliver this training. Not so simple as like stamping out widgets, because such a big part of becoming a master facilitator is the experience. Having this co-trained model is a step, or maybe a stepping stone to broadening, but it's essential to kind of experience this as the facilitator. I found that when I started, I had to see it work almost to really understand how it really worked, because we have the publications, we have the data, we have the evidence, we have the manual, the curriculum, the script, and all of those things that prepare someone. But until you actually experience it with participants, several times, it's difficult to really see how it works. How do we provide that opportunity for facilitators, to gain experience in a setting or across multiple settings? So I think those two things are pretty important when you're looking at growing a program. A solid footing with key leadership, administrators, and really showing them what it is, not just what it produces, but what is it? It's going to have to permeate through their messaging and other things that are going on. How do we bake it into the culture? Part of it is going to be increasing the training volume, increasing the number of facilitators, but also, taking some of the core concepts of the program and seeing where do these align with other initiatives. Where does this fit in with what you're already doing? It has an opportunity to help those things, but also you're building sustainment because you're bringing concepts together so that everything isn't just a series of standalone, interventions.
And we took the time to make sure that we don't have a manualized, modularized training, right? We understand that every new environment is going to have front loading that has to happen. That's the piece that when people upscale programs, they make it manualized, right? You can do this on day one, you can do this on day two, but there's not a lot of support within those pieces.
Going back to single session trainings, and the appeal of those on an efficiency basis, a diminished time constraints, costs, all of those things, it's equally appealing, to manualize a curriculum too rigidly, because then it's done and it's just delivery, replication, and that. But at that point it's no longer living content. It needs to be alive so that people can bring it to life in the training. So it needs to be, in tune with what's happening right there.
But sadly, so many of those programs are based upon the number of participants that you present in front of versus the quality of, is it actually making change? And I've heard from communities, and I've heard from a different military entity that, as long as they're present and they sign off on the check sheet, then it's a good training. And that's why we saw programs not be done and not show any growth, or actually the number of referrals go down over time because of that. And we've talked about, I think that's a good point to talk about, is, being that I was a science teacher, and when people would come in and say, you need to do this because the district is requiring you to do this, I was like, I'm a science teacher. I'm not a counselor, I'm not a therapist, I'm not a social worker. This is way outside of my comfort zone.
Mm-hmm.
And I think we talked about the fact that we're relationship based. We're not diagnostic people, right? I don't look at you and say, oh, I wonder if Brian's battling depression today and here's my 18-point checklist to do that. No, when I saw you today, it was relationship based, right? And we had this conversation around prevention.
And I think that ties back in with this idea of ecological validity. How many programs are being delivered because they are ecologically valid amongst a school administration? It makes sense. Like in their world, what they are responsible for, this is a logical step. This makes sense. It's utilitarian. But that may not address the ecological validity of the recipients, of the student population. Or same thing with the Air Force. As you talk to any service member, there's lots of decisions that won out over other decisions made at the Pentagon that nobody, boots on ground, can even wrap their head around. So the idea of ecological validity is true, thinking about the entire environment. And like a lot of things, like I said, there's the people making decisions. And if they don't or aren't reminded to, have something that's ecologically valid at all levels, then it's natural that they just kind of look as far as their vision can carry. That's what's being matched up against, for these interventions. With Wingman Connect, we use the 4-core model of kinship, purpose, guidance, and balance. And a big turning point in that training is a declaration of what's already evident to like everybody who's been through it. In the midway through the 6 hours of training, halfway through day 2, we bring folks to this idea that relationships really are at the core of the cores. And from that point, that becomes the lens that everything is it's no longer being looked at as a individual skill of something that just exists in your own psyche. These are not thought bubbles anymore. This is something that is actionable and exists as part of relationships. But that also opens the doors to actually doing things. We can talk about this as a group, and we can see this isn't about right and wrong answers. How do we strategize? How do you move away from this idea of content being the medium to change behavior, or didactic descriptions of skills versus experiences? Our relationships are not defined by manuals, or words. They're defined by our experiences. So if we're not providing the experiences and we're just providing, the definitions, it's understandable. Like people just can't do as much with that. Most people don't like being quantified. So when we preface any discussion that is about relationships or about our social connections or our emotions, when we preface it and just frame it right from the get-go as we want to take your experiences, your connections, your relationships, whatever it may be, and we want to assign it a numerical value. It may not be the most productive way to discover a way to grow, or to build. If you start a sentence with somebody who if you were to rate yourself on a scale of 1 to 10, they don't want to answer whatever question you're going to ask next. It has a very cold, clinical, feel to it. And there's always going to be situations where quantification is important. We're researchers. Quantification is important. But, we also can't build training material. We can't build training modules out of survey items, with the same language that have, the same feel, because that's not how people interact. That's not what allows people to find that common ground. And I think that's the other part that comes to my mind is whenever you quantify an individual, you're decreasing the ability for people to find a shared bond, shared purpose, similarities. Like, what is their common ground? Because now anybody who has a different number is different instead of having that commonality. So I think a lot of different ways as a society we quantify everything.
And we're not looking for the strengths again, we're looking for indicators. weaknesses or concerns, right? And so, yeah, I've never in all my life of working with tens of thousands of students and adults over the years had anybody ever walk up to me and say, instead of, "Hi Tim, I am so-and-so," say, "Hi Tim, rate yourself on a scale of 1 to 10 where you're dealing with your emotions today."
Yeah.
Right, that was never in any conversation I've ever had, right? But yet, that's what we train. And a classroom of 30, 35 students, and we just know that's not a realistic approach.
Well, I mean, look at psychological questionnaires. Like, there's hundreds of questions. We use adaptive testing because it's very difficult to, without a lot of questions, really arrive at a, precise quantified number. But like, it's unnatural. We don't necessarily build relationships around people based on, an idea of numerical values. We build it off of the remaining, 99.9% of our spectrum of beliefs and ideas of value and valued connection.
So, when is competition bad, and how do you get people to believe that when they're doing it the rest of the day? Or is it? Am I just thinking?
I'm going to throw it out and then I'll let you keep going. I think if you're trying to build supportive networks, right, as long as there's somebody who benefits and somebody who loses, which is part of competition, we're going back to that again, I think that can be very damaging to building a cohesive, supportive network. I guess from the peer leadership model also, of like we're just going to take peer leaders, and you alluded to it, we're just going to take peer leaders and train 30 peer leaders in a school of 2,000, and all of a sudden people are like, well, why were they chosen? Why wasn't I chosen?
In instances where competition, can precipitate pruning, social pruning, I think it's almost in an aspect where that competition is unchecked, because we utilize competition within the training itself, but we have to rebrand it as healthy, and that competition is not to establish a cutoff in the group to where everyone above that line or below the line is either a success or a failure. We use healthy competition in the context of that participation and really just enjoyment. So we understand that competition is prevalent everywhere, especially in the military. So right from the very beginning, we kind of built that into the training. How can we utilize competition, but reframe it as a connection building, socially positive activity? You're never going to be able to remove this idea of competition. So how can we use it to our advantage? We create the space for people to make connections surrounding looking at their own lives and looking at their own relationships and looking at their relationships amongst each other, just using this conceptual model. That provides them the alternative to, are we going to stratify each other by grades or by our PT test scores? Are we going to allow those things that are competitive and quantified to drive distinctions between us? But providing the space for these people to connect on more than just what is measured and documented, about them, lets them, be more than a number, and that's what really protects from the pruning. It's not that we're removing competition. It's that we're providing a counterbalance to the type of competition that can be, limiting in terms of building and diversifying a network.
And I think it's also interesting, going with Rich's point too, but what do we acknowledge as competition? So if you win the wrestling state, awesome, and your plaque goes up on the wall. But if you're an artist and you're recognized for great work, and then you win an art show someplace locally, regionally, or statewide, there's no plaque on the wall. We don't see all parts of recognition. So I think it's also that we give value to certain competitions and not others.
I think, that's going to be true in any population. There's going to be, those competitive aspects will be weighted differently, by the norms in that society. But regardless of wherever those land, I think that's something that we always need to be aware of when we approach a new population or go into any population to train, is like, what are those norms? But regardless of where they are to start with, just by kind of approaching competition differently, as like, this is purely to build network health and enjoyment, and get people to know each other better. Even regardless of where the baseline is, you're now providing like another dimension to really view competition, and really address it in a positive and healthy way, as opposed to just letting it, be, self-determined by the environment.
And I think there's a story that fits in right now, and again, I can never remember her name, but she was too cool for school for day one. Basically told us at the end of the day that I'm educated, this is a waste of time, I know more than you guys, right? And then all of a sudden, day 2, we start talking about strengths, and everybody brings their strengths out. By day 3, she made a comment, I'm gonna have you replay this a little bit, like, well, I know you all find this annoying, and the class immediately came back and said, oh, no, we really appreciate that aspect of you, because that really helps us achieve as a class, right? And then our final debrief was, this was like the greatest thing that I've ever experienced. Yeah, I mean, I think that's a really good story to talk about how group norms, finding strength, support really can change an attitude.
The military is a highly competitive, environment. Like, everything is measured, and in a lot of cases, your scores are public. So, how you're being measured is not disguised. People can get pretty overwhelmed, like in the early stages of that, and like we see, people who are in that state, just like we talked about a few moments ago about competition in the absence of healthy competition. People can adopt a very individualized and also isolated perspective. In the case you mentioned of an airman being in that state and really only being able to see and evaluate and integrate the perspective of someone who is struggling, and that it's public, it's well known to the people around her that they were struggling, and that's her persona within that network. By going through the training, not just as an individual, but with the people right around her, like they did, a great group, laid some things out and really did find some different dimensions where there was shared purpose, shared values, shared goals, things that they had in common, with this airman who was really struggling, and also were the ones to point it out to that individual that that they were the last ones to see it. Like, all of the other people, in that group who were succeeding, who were thriving in their early military careers, had to explain it. She'd been seeing it from her side, and her self-perception of like being alone for so long. It took the rest of their class to kind of bring them into the light, and seeing like, no, like you're not struggling, like with all the things that we've talked about this week, like you are, really intelligent, like you're great at school, you're balancing so many different things, but we mentioned in the training, like as individuals we can often be our own harshest critics. But if you're not having these discussions with the people right around you and really providing an opportunity for people to express to other individuals, like, this is where I see, your strength. I really respect that. I admire this about you. If we don't create that, those opportunities for people to receive, respectful admiration of their peers, like, then they don't have that to build from, like, in their day-to-day lives, and then everything goes back to the way it was, which is like it's just a series of quantified skills, applications, and abilities, and like we are the sum of those numbers.
The group absolutely reframed her self-talk from where she thought her behaviors were annoying, to no, they're hugely, a strength that really helps the class succeed at a higher level. But again, right, the group norm and the group voice really just came through and changed that person. And obviously, it's great to be able to see those light bulbs go on and those moments happen, but we see it all the time.
We still talk about that because one of the things we do all the way at the end of the training is asking people to first, share something that they feel pretty good about, like something that they're really strong in right now, and why they're strong in that area, and to see, someone who was hesitant and maybe wasn't that engaged at the beginning of the training has clearly got a lot on their plate right now to come to that conversation when it was their turn and say, I don't really think I'm strong in any of these things, and as a facilitator to just let that sit for 2 seconds and then to see a pour out from the rest of that class to like come in and disagree with that statement and tell her like, no, you have, lots of amazing qualities. You bring a lot to this class. Like, you're always keeping everyone honest. You're always calling everyone out to like keep us straight and narrow on what we're doing. Like, and you can really see that. And that's what creating that space will do, is it makes that opportunity for the other participants, to make that connection.
Complete the following sentence.
Oh, I like these.
In the context of what makes a successful program. But complete the following sentence. Some people might be surprised by this, but the data shows that blank.
The first one I'd say, when we analyzed the data from the randomized control trial for Wingman Connect, one of the things that we were surprised by was a 50% reduction in occupational impairment. So how much were people getting into academic trouble? Were they being, receiving basically negative paperwork? Because we're not addressing disciplinary avoidance in our training and all. This is just protection, and connections and things like that. So we were very surprised to see such a stark reduction in the number of Article 15, Uniform Code of Military Justice infractions, negative counseling statements, and as well as airmen being washed out of programs. Like, pretty staggering for us to see that 50% decline. Another finding from the data that I think most people aren't expecting, primarily because they're just not thinking about individual risk in this context, but was the mediation analysis that we did, where we looked at group levels of change in suicide risk, depression, anxiety, but also group morale and healthy, group observations of healthy norms and behaviors, and created this group level of whether a class was thriving or struggling. So that's all the members of the groups across all of these different measures. Like, what is that average value? And what we saw was, in both suicide and depression, when the entire class showed impact, showed change and positive movement in that thriving class factor, it accounted for about 25% of the individual risk reduction. So any member of that class, if they had a measurable reduction of risk for suicide, really about 25% of that was accounted to the shift in group norms. So this reinforces this idea that individuals are being directly impacted by their immediate surroundings and peers, but also the necessity of doing upstream universal prevention, where thriving individuals, where individuals who are very healthy, who are succeeding in whatever's being thrown at them, are within the training directly with the other individuals who are struggling, so that they can leverage that influence. But I think that was always pretty interesting point, particularly to a lot of the senior leadership that we see in the military, where the standard for many decades has been identification of high-risk individuals and then applying additional effort to those individuals, which requires them to be essentially pulled out of their population and intervened upon.
And I think the other one, I think you just touched on it too, is that the research showed that even though we understand that the people with the most growth potential grew the most, right? But everybody grew. So if you are thriving and successful, you continue to grow by helping others,
Mhm.
right? So you had growth by supporting others, and you had growth by being supportive. Yeah, I mean, I want your voice on tape too, right? But you remember, I mean, you guys had talked, you showed me that really early. It's like everybody grew, and if you're at the 99 percentile, you still grew, even though you had shorter
Right.
space, right? But,
Yeah.
yeah.
Yeah, I mean, the findings did show that, like, this, and, you know, in particular, when you think about the origin of why this program was developed, you know, it's, you know, suicide prevention. So it was pretty surprising at the end to see that individuals who, you know, were 0 on a scale of 0 to 100 for suicide risk were still benefiting, you know, from this training in other ways, because, you know, potentially because in the context of focusing on the group, they actually have the opportunity to, you know, share their experiences, share their successes with other individuals who are, you know, who are struggling. But yeah, to see the entire group as a whole, as well as the individuals all benefit from the training, but to see magnified benefit on individuals at the highest risk at baseline. So, you know, really making sure that the strong members of groups, you know, this provides some abilities, some mechanics for them to help lift up, you know, people who might be falling through the cracks or struggling without anyone really knowing that they are, or without really identifying how or why they're struggling and making that a focal point.
There was a chart that you did, and it showed 1 out of every 44 airmen,
Mm-hmm.
and then I think the other one was 1 out of 28 airmen, right?
21.
So, 21. So the 1 out of 21 was high depression, and the 1 out of 44 was suicidal?
Right, yeah.
So every time we did a group, we had 2 individuals at a minimum
Mm-hmm.
that had high depression and high suicidality.
Yeah, so the figure that corresponds to that is likelihood. So like I mentioned, we used an adaptive testing to measure anxiety, depression, and suicide risk, and what we found was, you know, at baseline, you know, pretty consistent with what we would expect and what we'd heard from our partners in the military, as well as, you know, knowledge about general population. About 10 or 11% of people at any given time at baseline. Now, granted, this is a tumultuous period. They had just joined the military, so life's not super easy for them. But 10 or 11%, you know, were they to be interviewed, you know, by a physician, you know, would be likely to have significant enough depression to be considered within a major depressive episode. You know, what we saw in the findings from the RCT was that the number needed to treat was actually pretty low. You know, it was about 21. You know, an NNT of 21. So for every 21 people who received the training, it would produce 1 fewer, you know, airmen at elevated depression. And we saw a similar with, you know, obviously high suicide risk is a much more rare outcome, but 1 in 44, number needed to treat being 44. So for every 44 airmen who received the training, that would equate to 1 fewer airmen in the population who are above that kind of critical threshold of suicide risk, where you know, is indicative of suicidal ideation, but like enough risk that it would easily register in a, you know, a physician's interview.
Right. So every time we did a group, we served about 40 to 50 airmen in a group.
Mm-hmm.
So every time we did a group, we had 3 people at risk. And we ended up with 0 suicides, right? I mean, that's the part I'm trying to get to right now. It's like we worked with the highest, right? I mean, we were there, right?
Mm-hmm.
We were in that, we had the targeted audience,
Mm-hmm.
right? Statistically, we shouldn't have had these numbers if we were doing what we were doing. I know that's a huge responsibility on our shoulders, like we got to keep this thing going forward, but that's the numbers,
Mm.
right? Is that we had 3 at-risk people of high depression, and as I said, every time we sat down, every time we do sit down.
Regarding the findings and the data and considering, the impact alone, and I think misses one really important thing, and that's that we're not putting any of these individuals. That's the great question, right? Is how do you get to individuals in a population that are unreachable? Like it's not publicly known that they're struggling. We're really good as a society to teach people how to hide, their problems, and we're not just forcing everyone through, a head to toe psychological exam daily. For these individuals within our communities that we know are struggling, how do you reach those individuals? And that's what's different about this, is like we're going about it this way that we know will reach them, which alleviates us the responsibility of having to try and identify them and put the spotlight on them and further ostracize them, by making the connections and promoting a positive direction, and the direction of healthy norms and behaviors that they can work on together, within the people right around them. That's how you get to the people that can't be gotten to. Is this upstream universal prevention. There's no other efficient way without rigorous evaluation of every single person, which is going to change very, very rapidly, of figuring out where do you focus your efforts to get the personnel that need it, to get the training to those that really need it. And that's what this does. And that's what's different, is it doesn't require identification. Because you're taking a foundational approach. You're getting ahead of the diagnosis. That's the piece that, no matter how great intervention is, it's going to struggle to get to that 100% effectiveness, without something like this, because there's always going to be individuals that are just not registering. They're not going to get caught in the identification nets. They're not going to declare, that they're really struggling.
So there's the statistics that the Air Force did. They went back and looked at the last 600 suicides before the study started, correct? And what they found out was less than 40% of them had any type of mental health support at any time in their life, that any of them mentioned it,
Mm-hmm.
right? So the best we had looking backwards,
Yeah.
right? So the person took their own life, we looked backwards, so now we know we should be finding stuff, and we only found 40% of them at any time in their lifetime had a breakup, mental health support, mentioned it, right? Is that also true?
I've always found that to be one of the most interesting data pieces.
I have the slide here if you want to look at it.
Well, I remember well. That was actually the study that I was recruited here at the university to contribute to, which was a retrospective analysis of suicide deaths for a period of 2002 to 2015, and we ran a survival analysis to try and establish risk and protective factors, as well as community factors that led to those outcomes. But in looking at the the individuals that were lost, about 45% of them had high risk factors, known high risk factors, or multiple high risk factors. Individuals who had essentially been pulled off the line, were in treatment, had very significant issues that were well known and documented. That accounts for about 45% of the suicide deaths over that period.
Yeah, and according to the data, only 20% ever communicated any suicidal intent at any time.
The second group is also interesting. So that another 45% of those suicide deaths were individuals with known issues, but nothing that meets the criteria with the previous existing suicide risk identification metrics that anyone that would have been essentially they had issues but no red flags.
Mm-hmm.
Then that leaves about 10.5% that had absolutely no warning signs whatsoever. By everything that's being measured, their career in the military right now is a success. Now, things may have come out after event investigation, but at the point that we lost those individuals, everyone saw them as succeeding in every capacity that was being monitored. And that's important because, if we think about the, these percentages, that first group, number one, 100% of your prevention efforts is only going to that group, because the other 55% is, smaller than the squares in your safety net. But also thinking, from a force standpoint, from a utilitarian standpoint, for the bean counters, that 10% that had no signs, in a lot of ways they were outperforming their peers. Like, they were holding multiple positions. Like, that's, you can look at it and say, like, well, that's only 10% of the total, but that 10% is some of your highest achieving, highest performing, members. So, and the degree of communicated intent prior, I believe, is even lower than that 20%. Mm-hmm. That 20% may include, things like suicide notes as a method of communicating intent.
So if we're going to just sit out there and wait for people to tell us, we're going to miss 80% of them.
Oh, yeah, probably more.
Or if we're going to go back and say, well, they had professional counseling or whatever, we're still missing over half, 55%, right? So
well,
that's the part I want to make.
Yeah, and I think going back to the original one, what's the predictor? And it's like, if that's the route that you want to take to address, this epidemic, is we want to predict and isolate and intervene. The best predictors are going to cause you to work 100 times harder, at least, probably more like 1,000 times harder than you need to, because you're going to have to identify and intervene on 1,000 people to catch one. And that's just not a very effective strategy.
And again, sadly, that is what our model is, right? That's most widely used in the United States, is we're going to find that one. That's
complex, though, in itself, because just the effort alone, undertaking that effort, indicates we are dismissing the negative effect of an individual being identified as, that one of those 1,000 people. Like, that's, for those 1,000 people, 999 are going to have a negative experience by that whole thing, because they were not on that pathway, but they came, they were positive in the evaluation. So, this idea of reaching the people that, can't be reached through traditional methods, that's not what we're trying to do. We're not trying to identify at-risk individuals. We're trying to reduce, the risk of at-risk individuals. So, let's go this other route where it's like, let's benefit everyone, and also allow the other individuals who are not at risk, those individuals who are successful and thriving, let's give them some ammunition to help the others right around them. And we're not obligating them. We're giving them an opportunity to share what works for them, to see the people around them in a different light, to understand that their health and well-being and their success is also tied to, the people right around them.
Associated Press ran an article last week that said this identification in younger students, primarily middle school and elementary school, because they're doing it in mass ways, is causing so much harm to kids. Because now it's like, yeah, I can't remember the whole article, but it's like, no, we're causing trauma in kids in this stuff. And they're coming out and saying, we need to back off this. There has to be a different approach, right?
Mm-hmm.
Crazy.